When we think of antibiotics, beta-lactams often come to mind, which includes penicillins, cephalosporins. But what happens when bacteria develop resistance to these drugs? That's where non-beta-lactam antibiotics step in. These powerful alternatives bypass beta-lactam resistance and attack bacteria using unique mechanisms. One major way they work is by preventing bacterial cell wall synthesis, but in different ways from beta-lactams. To understand this, let's use a construction site analogy. Imagine a busy work site, where bacteria carrying wheelbarrows represent transport proteins, moving NAM and NAG across the bacterial membrane. Bacterial security guards symbolize beta-lactamase enzymes, defending the bacterial masons, also known as PBPs, which construct the cell wall. The wall under construction represents the bacterial cell wall itself. Now, let's focus on a key class of medications, bactopernyl inhibitors. The best-known example is bacitracin. Bacitracin prevents the recycling of bactopernyl phosphate, a key transporter for NAM and NAG. Without it, cell wall synthesis stops. Unlike beta-lactams, which target PBPs, bacitracin disrupts precursor transport, a completely different strategy. However, due to its toxicity, bacitracin is used topically for skin infections. While effective against gram-positive bacteria, gram-negative bacteria resist it due to their outer membrane barrier. Resistance develops when bacteria modify bactopernyl or use efflux pumps to remove the drug. Now back to our construction site analogy. For this class of medication, we are attacking bacterial membrane transport proteins represented by the wheelbarrows. Let's have a basilisk, representing bacitracin, attack them. Let's have one bacitracin shed its skin because this medication is for topical use only for treating certain skin infections. Beta-lactamases are bacterial enzymes that break down beta-lactam antibiotics, rendering them useless before they can attack the bacterial cell wall. To counter this, we use beta-lactamase inhibitors, compounds that bind to and inactivate these enzymes, restoring the power of beta-lactam antibiotics. The most commonly used beta-lactamase inhibitors include clavulanic acid, sulbactam, and tazobactam. They are often used in combination with beta-lactam antibiotics. Example: clavulanic acid is used in combination with penicillin as augmentin. Now, let's visualize beta-lactamase inhibitors with a memorable scene. Imagine bacterial security guards. They represent beta-lactamases, standing watch to neutralize beta-lactam antibiotics before they can interfere with bacterial cell wall synthesis. But now, reinforcements arrive, our beta-lactamase inhibitors, each with a distinct role. A towering volcano erupts, symbolizing clavulanic acid, a powerful inhibitor with a dramatic impact. A tall police officer, firmly gripping a baton, stands for tazobactam, ready to control resistance. A saluting officer represents sulbactam, standing in defense against beta-lactamase activity. Since these inhibitors are used in combination with beta-lactam antibiotics, we see a lady police officer holding a giant pencil, signifying the beta-lactam antibiotics they protect. Together, these inhibitors disrupt bacterial resistance, allowing beta-lactam antibiotics to do their job, breaking down the bacterial cell wall and stopping infection. Brace yourself, because the next powerhouse of antibiotics we're going to talk about are the mighty carbapenems. These are a class of beta-lactam antibiotics known for their broad-spectrum activity against both gram-positive and gram-negative bacteria, including many drug-resistant organisms. They are often used as a last resort for severe infections caused by multi-drug-resistant bacteria. Carbapenems inhibit bacterial cell wall synthesis by binding to penicillin-binding proteins, PBPs, leading to bacterial cell death. They have a broad range due to their stability against most beta-lactamases, except for carbapenemases and certain metallobeta-lactamases, MBLs. Examples of carbapenems include imipenem, meropenem, ertapenem, and doropenem. Imipenem is often combined with cilastatin to prevent renal degradation. Ertapenem lacks activity against Pseudomonas and Acinetobacter. Alright then. Amongst the monobactams, the only one in clinical use today is aztreonam. Unlike other beta-lactam antibiotics, monobactams have a single, non-fused beta-lactam ring. This unique structure makes them highly resistant to most beta-lactamases. Aztreonam is highly effective against gram-negative bacteria, including Escherichia coli, Proteus species, and Pseudomonas aeruginosa. However, it has no activity against gram-positive bacteria or anaerobes. Aztreonam is generally well tolerated and is a safe alternative for patients with penicillin allergies due to its minimal cross-reactivity. With its strong gram-negative coverage and resistance to beta-lactamases, Aztreonam remains an important option in the treatment of bacterial infections. Alright, that was a lot of information to take in. Welcome back to our construction wall analogy. This time, the scene is full of hidden clues to help you lock in your pharmacology knowledge. Remember the Masons at work, our symbol for PBPs or penicillin-binding proteins. Suddenly, they are attacked by an emperor. This emperor represents imipenem. But he's not alone, he's carrying a cell-ly stick, reminding us of celastotin, which is always given with imipenem to prevent its breakdown. Now, take a look at the emperor's shameless army, they are hiding. Why? Because they've misinterpreted the scene. And that word, interpret, should remind us of ertapenem, which is ineffective against Pseudomonas, that's why the army is hiding. But wait, in the distance, we spot an astronomer, our key to remembering Aztreonam, the only monobactam in clinical use. Now, among the Masons, there's one who stands out, she looks just like the Mona Lisa. This should immediately remind us of Pseudomonas. And what is she carrying? A cinema ticket, which should make you think of Acinetobacter. And in her other hand? An aquarium, symbolizing anaerobes. So, through this vivid scene, we've linked our key drugs, imipenem, celastotin, ertapenem, Aztreonam, and their bacterial targets and exceptions. Keep picturing this in your mind, and you'll never forget these pharmacology facts. Finally, glycopeptide antibiotics are a powerful class of drugs used to combat serious bacterial infections. The most well-known members include vancomycin, telavancin, and teicoplanin. They latch into tetrapeptide chain preventing linkage. By doing so, they bypass mutations in penicillin-binding proteins, making them effective even against resistant bacteria. Because of their unique mechanism, glycopeptides are especially valuable in treating drug-resistant infections, such as those caused by MRSA and other gram-positive pathogens. Welcome back to our construction site. This time, we're standing in front of the bacterial cell wall, where 3 special vehicles have arrived, each representing a glycopeptide antibiotic. First, we see a van with a mouse logo, that's vancomycin. Next to it is another van, but this one has a TV logo, that's telavancin. And flying above, we spot a police, or cop, plane, representing teicoplanin. These vehicles all have the same mission, blocking the construction of the bacterial cell wall by latching onto the tetrapeptide chain, preventing proper linkage. Nearby, we notice 2 key objects. A closet, symbolizing Clostridium bacteria. A Mars rover, representing MRSA, a notorious antibiotic-resistant pathogen. Luckily, our 3 vehicles can still stop these threats, even when traditional antibiotics fail. By bypassing penicillin-binding protein, PBP, mutations, they remain effective against resistant bacteria. And with that, our construction site tour comes to an end, highlighting how glycopeptide antibiotics stand strong in the fight against tough infections.